afternoon, everyone. This morning, the Cabinet met to decide on the next steps that the government will take to respond to the coronavirus emergency. These are unprecedented actions to respond to an unprecedented emergency. We agreed actions in three areas. First, new measures to slow the spread of the virus, as recommended by the CMO and the National Public Health Emergency Team, an expert team of public health doctors, virologists and scientists. Second, new measures to assist those who have lost or will lose their jobs as a consequence of the emergency, and a scheme to ensure that many others do not and remain on the payroll rather than being laid off. And third, new emergency legislation that we're asking the Dáil and Shannon to enact by the end of the week. Before I go through them in detail, I want to once again thank all of you for contributing to this great national effort. Thank you to our health service staff and our civil servants as well, our local authorities, our volunteers and NGOs, our defence forces, our Gardaí, our retailers, farmers and transport workers, carers and care workers, postal workers, and those working in industry like pharma, food production, food service and medical devices. And thanks to everyone who's helping out and helping others in a million different ways. Anyone in religious life, our journalists and broadcasters, everyone doing their best to raise the spirits of our country. You're rising to this challenge, and the nation is grateful. This morning, NPHET met and has recommended some new actions to help us slow the virus. We've accepted its advice, and the advice will be published in full today in accordance with standard practice. Above all, I want to thank the people of Ireland for listening to the advice when it comes to physical distancing, regular hand washing, taking care when sneezing and coughing, and reducing the number of social events and gatherings that you attend. It's too early to know for sure, but we do believe it's making a difference. However, we believe we need to do more. We need to flatten the curve and suppress the virus. So I'm asking you to stay at home, if at all possible. This is the best way to slow the virus, ensure our hospitals are not overwhelmed, and buy us time that we need to build more capacity, testing, contact tracing, beds and ventilators. So you should only leave home to go to work if you can't work from home and your attendance is essential. You should only go to the shops for essential supplies, out for medical and dental appointments, or to care for others, or take physical exercise. Non-essential indoor visits to other people's homes should be avoided, and social gatherings of individuals outdoors should be of no more than 4 people, unless you're all from the same household. We're in this for the long haul, and this could go on for weeks, perhaps even months, so we need to maintain our humanity as well. And it is okay to see our families and loved ones, because we have to look after our mental health as well as our physical health. But we have to maintain physical distance, do it in small groups only, and much less frequently than we would have in the past. No unnecessary travel should take place within the country or overseas, now or over the Easter break. In order to assist all of this, the restrictions I announced in Washington, D.C. are being extended until Sunday, the 19th of April, and the following new actions are being taken, effective from midnight tonight. All theatres, clubs, gyms, leisure centres, hairdressers, betting offices, marts, markets, casinos, bingo halls, libraries, and other similar outlets are to shut. All hotels to limit occupancy to essential, non-social and non-tourist reasons. All non-essential retail outlets are to close to members of the public, and all other retail outlets are to implement physical distancing. A list of essential retail outlets and stores is being provided. All cafes and restaurants should limit supply to takeaways and deliveries only. All sporting events are cancelled, including those held behind closed doors. All playgrounds and holiday caravan parks will close. All places of worship are to restrict numbers entering at any one time to ensure adequate physical distancing. All organised social indoor and outdoor events of any size are not to take place. The Gardaí will increase interventions where venues are not in compliance with or where groups of people are not adhering to recommended social distancing. All household contacts of a suspect case, that is somebody waiting on a test or a test result, should restrict their movements until the test is reported as negative or 14 days after the onset of symptoms, whichever is the shorter. As I mentioned earlier, individuals should work from home unless attendance at the workplace is absolutely essential, and social gatherings of individuals outdoors should be of no more than 4 people unless all are from the same household. All non-essential indoor visits to other persons' homes should be avoided. All crowded places, including public amenities, should be avoided as well. And all scheduled cruise ship travel to Ireland will cease. Any setting that should close has been specifically identified today. And the requirements that workers work from home, unless attendance is absolutely essential, is not to be read as meaning the factories or construction sites have to be shut. The authorities are available to work with employers and unions on how to make physical distancing effective where that's possible. There's going to be an increased presence of park rangers and Gardaí in parks and public places to ensure that physical distancing is being observed. In Ireland, since independence, we've always had policing by consent rather than by coercion, and I don't intend for that to change now. That's not our way. The new powers afforded to the Gardaí will be used sparingly and only where necessary. Let's all play our part to ensure they're not used at all. I believe a liberal democracy can do this without the need for authoritarian or draconian actions. The impact of Covid-19 on our economy and employment has been sudden and will be enormous. I believe we need to maintain social solidarity, unity, and a sense of community in this time of trial. In recognition of the fact that so many fellow citizens have lost their jobs so suddenly, we're raising the COVID unemployment payment to €350 a week. That's approximately 75% of average earnings in the sectors most affected, and compares favourably with what's being done in other jurisdictions. The first payments will be made on Friday. The COVID illness benefit for people who are self-isolating will also increase to €350 per week, and that can be topped up by employers. In order to encourage employers and companies badly affected by the emergency to keep staff on the payroll, a wage subsidy scheme will be introduced to co-fund 70% of the cost of salaries up to a maximum of €38,000 a year. So for a salary of €38,000, the subsidy would equate to €410 a week in take-home pay. The cost of all of this will be great, many billions of euros in the coming months. But we can bear it, and we will be able to pay it back as a nation. We do so willingly because it's the right thing to do, and because we owe it to our fellow citizens. I strongly believe that maintaining the link between employees and employers and companies will make it easier for us to bounce back when this is all over. We'll keep our economic infrastructure intact, and will give business the best chance possible of making it through. The self-employed will also be covered, and I know the sacrifices that many of our self-employed have made to build up their businesses and practices, and I know how worried they are at the moment, how vulnerable they feel. And government will do everything we can to help sustain you and bring you through this emergency as well. Ministers Donoghue, Humphreys and Doherty will set out in more detail how these measures will apply. Finally, Cabinet this morning approved the emergency measures in the public interest COVID bill. This legislation, for the duration of the emergency, will freeze rents, prevent evictions, make it easier for healthcare professionals to re-register and return to work, and enable former members of our defence forces to rejoin at the rank at which they left. We need you to serve your country once again and to strengthen our nation at this difficult time. We also approved a framework agreement with the private hospitals. They will operate effectively as public hospitals under Section 38 of the Health Act for the duration of the emergency, thus adding over 2,000 beds, 9 laboratories, critical care capacity, and thousands of staff to our health service. Public and private patients will be treated equally, and private hospitals have agreed to do this on a not-for-profit basis, and I really want to thank them for their cooperation in this regard. I briefed the leaders of the other parties yesterday, and will be briefing spokespeople today and during the week. In contrast to what we've seen in some other countries, our political parties have united against a common foe, and I want to thank them for their understanding, goodwill, and cooperation to date. Finally, another reminder to everyone to follow the public health advice and keep following the 5 key steps. They might seem simple, but they are vital to protect us all and to protect our loved ones. Regular hand washing, coughing etiquette, not touching your face, physical distance, and staying at home if feeling unwell. We cannot yet stop this virus, but working together, we can slow it in its tracks and push it back. These are extraordinarily difficult times for everyone in Ireland and around the world. But no matter what happens, we'll always put your life and your health ahead of any other concern. All of our resources are being deployed in this great national effort, and I know that the Irish people will continue to face this head on, to make the changes to our lifestyles that are required, and pull through to the other side. 4 years ago, we commemorated the 1916 Rising, and we celebrated the men and women who helped us win our freedom and independence. I never believed we'd be called upon to match their courage or example, but today we are. Working together as a country, we will come through this emergency. We'll be tested, but we will succeed. Our greatest generation was not in the past, and better times are yet to come. Thank you very much.
Yeah, thanks, Taoiseach. As we navigate through this very difficult public health emergency, we've clearly asked the Irish people to make real and great sacrifices. If we're being honest, it's all a bit surreal for people. People didn't see this coming. This is something that came upon us as a country and a world so quickly. We've asked people to behave perhaps counterintuitively, and the Irish people have risen. They've risen to that challenge, and we are, as the Chief Medical Officer outlined yesterday, beginning to see early and encouraging signs. But now is clearly the time to do more. This is a virus that knows no borders and no boundaries, and there are no easy options. If there were, we'd take them. But we can show the world what can be achieved through intensive, sustained public health action. At a time when we need national unity of purpose, we must of course have equality of treatment. Patients with this virus will be treated for free, and they'll be treated as part of a single national hospital service. As the Taoiseach outlined, today I received government approval that for the duration of this crisis, the state will take control of all private hospital facilities and manage all of the resources for the common benefit of all of our people. There can be no room for public versus private when it comes to pandemic. And while we're asking much of people, we are matching restrictive measures with a comprehensive public health toolkit. We're matching it with measures that have been commended by the World Health Organization as the right mix of tools. This will include increased testing capacity and linked contact tracing. But we've also, as the Taoiseach outlined, embarked now on a number of new restrictions and new measures. Through government decisions, the mobilisation of communities, which is going to be so important, and the leadership of our incredible healthcare professionals, we can have a profound effect on the impact of this pandemic on our people. But we can do more. We can save lives too. Often in the middle of a pandemic, something that seems so big, so global, we can perhaps feel so powerless. But the truth is, as individuals, we have an awful lot of power when it comes to slowing the spread of this virus. We clearly have so many heroes manning our front lines, but we need everyone in this country to be a hero. Be a hero in their own home, be a hero in their community. You can be a hero by taking the actions that will save lives. As a government, we must be and we will be responsive, but as a people, we must be and we will be responsible. We will be honest with you at all times, and we'll make the tough decisions. But we need you to make these decisions work. We need you to make these decisions really impactful. And this will mean some separation, but that need not mean division, for never was it truer that united we will stand and divided we will fall. Where we can no longer reach out with our hands, we must now reach out with our hearts. Keep our distance, but keep in touch. Stay apart, but stay in contact. To everyone who's already trying to do the strange new things we're asking, our message is simple: please do more. If you think you're already doing everything you can, our message is simple: please do more. And if, let's be honest, you haven't fully started to do the things that we're asking, please start now, and then please do more. Because the more we do together, the more lives we can save together. It is literally in the hands of the Irish people.
We're at an early stage, as we've said, in the progression of this illness, and we've seen much that gives us encouragement in terms of the response of the public to the measures that we've already recommended. One of the most significant early indicators that we've seen is that the number of cases that we see, or contacts that we see associated with an individual case, has dropped from in and around 20 a week ago to less than 5 now. That shows that the message is getting through, and that the message will get through if it continues in that way, to help us to push out the infection and the growth in cases. But we have seen other signs that have caused us to ask government to mandate more measures, and to ask the Irish people to work a little harder with us to try to ensure that we minimise the transmission of this virus through the population. And so, on the basis that we have now identified in the country in excess of 1,000 cases, that we have now experienced, sadly, 6 deaths, that we've experienced a day-on-day increase in the number of admissions to intensive care units in our country, that 45% of the cases that we've diagnosed so far have been community transmissions where we've not been able to identify the source of infection for those individuals, and where 1 in 4 of the cases that we've identified are healthcare workers. We think that these signs tell us that we need to move, as the ECDC has recommended again in its updated advice in relation to social distancing yesterday, that we move rapidly, coherently, comprehensively and decisively to recommend a step up in the terms of the measures that we've mandated. And it was for those reasons that we asked and advised government on the measures that have now been announced today.
Yeah, the legislation we passed last week empowers the Gardaí to detain people who may pass on Covid-19 to others, but we'd hope that that power is only used sparingly, if at all. But what Gardaí Park Rangers will be doing a little bit more of is a bit more of a visible presence on the streets and in public places, encouraging groups to disperse, encouraging people to move on, so that we don't have the scenes that we saw on Sunday, which we haven't really seen most days, but we did see on Sunday, of overcrowding in public places, which really went against everything that was being advised up until now. But I don't want to be berating people in any way. I'm sure all those people who turned up in the Phoenix Park at Glendalough didn't realise it was going to be so crowded, but what we will now have is a much stronger Garda presence and Park Ranger presence to make sure that doesn't happen, and encourage people to disperse and to move on. I wouldn't use the term lockdown, and that's for very good reasons. I've come to learn over the past week or two that lockdown seems to mean very different things to different people and in different countries, and therefore can cause confusion, and we need clarity rather than confusion. So I saw, for example, even though he didn't use the term, the changes announced in the UK as being a lockdown of the UK, yet when you look at the detail of what's being announced in the UK, people can still go to work, still go to the shops, the bank, the post office, even B&Q, at the pet food store, go for a run and meet with another person outside. So that, in my mind, isn't a total lockdown. And I had heard that Italy was in a total lockdown, and yet I found out only a few days ago that there were still factories and construction sites open. So I think it's a term that actually causes more confusion than clarity, and therefore is one that I wouldn't use and don't intend to use in future.
Taoiseach, you said that you would encourage people to visit families in a controlled setting for their good mental health. At the weekend, we were told to stay away from your mothers, grandparents, not to visit their grandkids. Are you now saying that, for example, grandparents can visit their grandkids, people can visit their mother? but the Minister for Health said we should still maintain distance. And secondly, you said that factories and construction sites will remain open subject to they'll be able to implement physical distancing. How are you going to tell if a construction site, a building site, is regulating with physical distancing?
Yeah, you know, that's one of the things we're going to have to work on, working with employers, working with unions. Construction sites tend to be outdoors, which is obviously much better than being indoors. And there are some that are essential, you know, some that are big constructions that's being carried out for pharmaceutical companies, for medical devices, healthcare establishments. So in the same way as when it comes to essential retail, we have to manage the risk. We would propose to do something similar when it comes to construction, but very much want the authorities, NSAI, the environmental health officers, the Health and Safety Authority, to work with employers and unions to get that right where it can be got right. It may not be possible to get it right everywhere, but we certainly can get it right somewhere, in some places, just like we have with a lot of the retail outlets. Yeah, on the first part of your question, just to be clear, I'm not encouraging people to visit relatives. What we're saying is that social interactions need to reduce considerably by 75% or more. But we're not saying that people can never see their family or friends or relatives. What we're saying is that must happen much less frequently. It must only be in small groups. Ideally not visits to other people's homes. And if it does happen, it needs to be done with social distancing and all of those precautions that we mentioned, like hand washing and so on.
Taoiseach, in terms of just clarity on essential and non-essential, how can businesses go about that to find out? You know, I know there's a list been released today to make sure that they are doing the right thing. And also, secondly, you've talked about the importance of an all-island approach to this. Are you satisfied that the measures are announced today are enough in step with what's happening in the north, that there won't be any sort of two different regimes working against each other, if you like?
Yeah, we do have a list which we can distribute of what are deemed to be essential and non-essential retail outlets, and anything that has to be closed was specifically mentioned either in my contribution or the letter from the CMO. There will be differences between North and South. We're doing our best to coordinate. Generally speaking, Northern Ireland is taking its lead from the UK, from COBRA and from London, whereas we're taking our advice from our Chief Medical Officer, NEFIT, the European Centre for Disease Control and the World Health Organization. So, for example, schools are still partially open in Northern Ireland and in the UK. They're totally closed here. We are saying that, you know, gatherings up to 4 people in the outdoors are acceptable. They're saying 2. And if you look across Europe, there are differences, and I know that does cause confusion. But the circumstances are different in different states. And we're very much behind the outbreak in the UK, and they're behind the outbreak in Italy and Spain. But in terms of what we're doing, we're actually ahead of the curve in terms of taking action. And it's not just about social distancing and social restrictions. What we have is what the World Health Organization recommends, which is a comprehensive strategy. So social distancing, social restrictions, but also a lot of testing, a lot of contact tracing and quarantine. And that's the South Korean model. It's the model used in Singapore. So far, it seems to be the most effective model to contain the virus, and that's the model we're pursuing. I'm not sure if the CMO wants to add anything to that.
So it's that set of comprehensive measures, as the Taoiseach says, that we've recommended in each of the steps where we've stepped up the response. We believe we've done it early, at an early stage in the disease, and responding quickly to things that we've seen or trends that we see that give us cause for concern. I've outlined some of those that triggered this new set of recommendations. Similarly, 10 days ago, we responded to early changes that we had seen in the number of cases in the population to enable us to as it were, get ahead of this. And we've done that in a structured way. It's not just a single measure or a couple of measures. It's a comprehensive set of coherent, mutually reinforcing measures for the whole of society to adopt, to reinforce the messages that we've had from the beginning around personal responsibility and personal behaviours, as the Taoiseach outlined earlier on. And we believe that's the most effective, likely strategy. It's consistent with what the WHO has recommended, and that we use that in conjunction with a clear public health strategy to identify as many cases as we possibly can, to make the recommendation to people to isolate themselves if they have symptoms, contact their GP, follow the advice of their GP in relation to testing from that point forward, and then the public health teams to institute effective contact tracing And it's those methods that we think will be impactful, and the information that I gave you earlier on in terms of the reduction in the number of contacts for cases is, if you like, a proxy indicator giving us some encouragement that the public is listening, and that the impact that we're seeking to have, we have some encouragement that we will see as we move along. But we now need, for the reasons that I set out for you earlier on, in terms of the impact that we're now seeing, particularly in terms of ICU hospitalisations, the need for us to begin to move with the measures that have been outlined today.
Taoiseach, just a couple of points of clarity first, if I can. Can you just clarify that the family members of those who are displaying symptoms and who are now been asked to self-isolate as a precaution, will they be entitled to illness benefit from day one to make sure that they have financial security? When you talk about restaurants being asked to restrict their services to takeaway, does that mean that you will show some latitude to restaurants who don't currently have planning permission to act as takeaways, who are only supposed to have dine-in? And on a broader point, some of what you've announced today are things that governments have said in the past that they could never do. The idea of freezing rents, a moratorium on evictions, co-opting the private healthcare system. What would be your message to people who think that that is the situation that Ireland should be observing all the time?
Yeah, sorry, so many questions there. I think your first question was, will the COVID illness benefit apply to household members who also have to self-isolate? The answer to that is yes, and that is a change from the advice from before, but that is the case. So if you're in a household that's being asked to self-isolate, then you will also be eligible for the COVID illness benefit. I could go into a lot of different issues in and around things, for example, like abandoned evictions or rent controls. Some people make an argument around constitutionality, but property rights are always subject to the common good in our constitution. I don't think anyone would argue that this is an extraordinary situation where the common good applies. But also certainly where we've argued against rent freezes, it's on the basis that a long-term freeze in rents would actually make things worse. It would reduce the supply of new housing, for example. It would mean what's happened in San Francisco, for example, landlords selling up and selling their properties on to people who then live in them. So therefore less rental properties becoming available. But this is a temporary measure. It's only for a few weeks, hopefully for 12 weeks. So the kind of things that we saw in San Francisco, fewer rental properties being available because of landlords leaving, Berlin, an investment strike with less new apartments going to construction. We don't think those things will happen when you do something as a temporary 12-week measure. Hopefully it's only 12 weeks, than you would as a permanent change in policy. Yeah, good question. That's such one of the things Minister Murphy is looking into, because restaurants that are now providing a delivery or a takeout service are providing a very valuable service. Irish people get about a quarter or 20% of our calories from takeaway meals, believe it or not. So that is actually an important service, and some don't have planning permission to do it. So that is one that I will follow up on from here, because I know it has come up, but we don't have a straight answer to it yet.
Good afternoon, everyone. As you are all aware, we are indeed in the midst of a crisis unlike any other in our lifetime. We are, as the Minister for Health said a moment ago, accosted by a pandemic that knows no borders and knows no boundaries. And in turn, this public health crisis risks an economic crisis. But if this public health crisis is like no other, then this economic crisis is also very different to others. It requires a different response. It needs speed and it needs scale. And this is because the very severe disruption that has occurred has placed otherwise healthy and viable businesses in jeopardy. Our citizens are under great strain. However, we will come through this, but this requires further action. Failure to act in line with the scale of this crisis would be too damaging for our society and for our economy. failure to act now, I fear, risks even greater economic challenges and difficulties in the future. It would also fail to abide by a central tenet of our social contract, the need for our state to respond at a time of great risk. So this is why today the government agreed a set of unprecedented measures. And my colleagues Heather and Regina, who worked on all of these different elements, will take you through all of them in detail. But the driving instinct behind these measures is the need to provide income support to those who need income support, while also giving confidence to employers to retain their employees. So when this crisis passes, the country can get back to work as quickly and as seamlessly as possible. Excuse me. To state it very clearly, support income to keep those in work at work, and by doing so, build economic demand and get ready to rebuild our living standards in our immediate future. So the wage subsidy scheme agreed today is a payment to employers to encourage, to get them to retain employees on their payroll during this period. It will be available to all employers who suffer either a minimum of 25% decline in turnover, an inability to pay normal wages and outgoings, and other circumstances as will be set out in revenue guidelines. For the next 12 weeks, such employers will be supported in the order of 70% of an employee's income, and the maximum weekly tax-free payment will be €410 per employee. This is, as the Taoiseach said earlier, equivalent to 70% of the net weekly income for someone on €38,000 per annum. For those earning between €38,000 and €76,000, the subsidy will be capped at €350 and implemented through guidance to be prepared by the Revenue Commissioner. So this will provide tapered support up to €76,000. And I am making this decision through government in recognition of the scale of this economic shock and the fact that it could impact on many sectors and many different kinds of jobs. The government also agreed today to increase the rate of the weekly emergency payment, and this was done because we have a clear duty to those who have just lost their job and experienced a massive and very sudden change in living standards. We are in exceptional times. The health of our people and ensuring we remain safe is our number one priority. So this strategy recognises the consequences of our public health challenge, but lays the foundations for economic recovery. The measures that the government is taking today aim to deliver that. They are designed to provide comfort, to provide reassurance to concerned citizens at a time of unprecedented economic risk. The government estimates that these measures will cost approximately €3.7 billion for a 12-week period. This is an estimate. The cost will vary in response to the breadth and nature of the shock. And as this is an emergency measure, it will lapse after 12 weeks. There will clearly be a significant impact on the public finances as a result of the scale of this intervention. But we must act now to avoid an even greater economic challenge in the future. And this response through our expenditure policy is crucial in dealing with this challenge. It will require a significant increase in our borrowing requirement in the months and maybe years ahead. However, we entered this crisis in a position of real strength. Our debt profile has improved significantly over the past 5 years, and our prudent management of the public finances has enhanced our sovereign credit rating. Supporting a proportion of the income of our citizens and thereby retaining a job, retaining a relationship with the employer during this crisis is the right and proper response of the state. The government has acted and will act this week, assuming the passage of required legislation. And this is because in these days, in these months of adversity, the care, the protection of our citizens is our abiding concern.
Thank you, Pascal. Good afternoon, everyone. And today the government is entering into an economic partnership with businesses and employers nationwide so that we can support them and their staff through this unprecedented crisis. It's hard to believe that just a few short weeks ago, Ireland was at full employment with record numbers at work. Practically overnight, the economic and employment landscape in our country has been utterly transformed by Covid-19. This crisis may be unprecedented, but it will pass. Through the measures announced today, we want to ensure that businesses are able to keep their employees on their books so that when we come out the other side, Ireland and our citizens can get back to work as quickly as possible. By keeping that crucial link between the employer and the employee, we will be best placed to kickstart the economy once again. While this is an extremely worrying time for businesses and workers, it's also worth remembering that for many firms, there are ways to use this time productively. For example, it could be a once-off opportunity to put staff on online training courses, get feedback from employees that you wouldn't usually have time to engage with, consider how you could make your business leaner, more innovative and more competitive, and draw up plans to improve productivity, consider new markets and future opportunities. In the meantime, through this new initiative, the government will support businesses so that they can continue to pay their employees. As Minister for Business, I would like to take this opportunity to once again thank the countless retail staff who are working around the clock to ensure that our supermarket shelves remain full during this difficult time. I meet regularly with the retail and grocery distribution sector who continue to assure me that we have a strong pipeline of products for our citizens. I would also like to thank the many people working behind the scenes to make this possible. Farmers, producers, hauliers, palleting and logistics companies, ports, ferry companies, and many more. And I also want to acknowledge those who provide necessary products and services in the medtech and pharma sector, and indeed those who support them. Today's announcement supplements the wide range of supports that we have already made available to businesses. They include the €200 million working capital loan scheme, which is open for applications on the SBCI website, and loans of up to 500,000 can be obtained unsecured. Loans of up to 50,000 through Microfinance Ireland with no interest or repayments for 6 months. The Credit Guarantee Scheme with loans of up to €1 million, including the option of refinancing existing loans. The local enterprise offices in every county are offering vouchers from €2,500 to €10,000 to support business preparedness. And the most impacted businesses can defer the payment of commercial rates for 3 months. The banks have also signed up to a number of measures to support businesses with loan and mortgage forbearance for 3 months. And these are just some examples. The new COVID-19 wage subsidy scheme will be a significant additional support, with the state funding up to 70% of wages, with no PRSI payable. it will result in a significant wage reduction for impacted businesses. The increase in the pandemic unemployment payments, including for the self-employed people, together with illness benefits, are also important additions. And I think it's important to say that this payment is available to those that are self-employed. All that said, this situation is changing from day to day, and I will continue to work across government and collaborate with businesses and the representative bodies to ensure that we are doing everything we can to protect and support Irish businesses. Thank you. Pass you over to Regina.
Thanks, Heather. I think Pascal is right when he says that we're living in exceptional times, and this virus is presenting a once-in-a-century challenge to Irish society. It's testing our cohesion, our resilience, and actually probably indeed our ability to respond. And whilst naturally this is first and foremost a public health challenge, it's also having and posing a very serious threat to the living standards and the livelihoods of the hundreds of thousands of Irish people. As the impact of the necessary public health measures are taking hold, many employers are facing very significant losses of revenue and with the consequential impact on employment. And I think it's almost impossible probably to predict the scale of the employment loss. I know I'm on record of one day last week predicting that maybe some 400,000 jobs may go, but I actually believe that this is a conservative figure because the job losses of the scale expected will pose a threat of significant societal effect. And I think that's why, since the crisis first began, we immediately introduced a system of emergency payments to get money into people's hands fast until we had designed a more robust response. And it's today that we're presenting that response. As well as the temporary wage scheme that Pascal and Heather have announced, we are announcing a substantial increase in the weekly rates of payments for the Covid-19 pandemic unemployment to €350 per week. And so where an employer can't retain a worker or avail of the supports of the temporary wage subsidy scheme, then that employee will be able to access the emergency Covid-19 unemployment payment, which is now at a substantially higher rate than it was when we introduced it only last week. This level of payment has been chosen for maximum impact, particularly for the workers that have been laid off in the sectors that have been most seriously affected. So, for example, the average take-home wage in the hospitality sector that has been so badly affected in the last week is approximately €403 per week. That's their take-home pay. And the new COVID payment of €350 is approximately 80% of the value of that normal take-home pay. In the retail sector, the average take-home pay is roughly €348 per week. So the new COVID-19 payment will in effect cover 100% of that value. And the rate, I hope, will greatly benefit most people who have suddenly found themselves out of work. And my department has strengthened our online facilities in the last week to make it easier for workers to apply not only for the COVID-19 employment supports, but also the illness payments, and it's allowing us to speed up the payments. This payment will be an immediate payment. We will also process applications through the normal job seekers benefit route as well, because some of the people that will apply will be those with dependents and may actually qualify for a higher rate than the €350. And what we intend to do is to move those people as quickly as we can, based on the resources that we have in the department, to the new rate with the uplift if they are so, if they qualify for it. And it will be backdated on any of the arrears paid from the date that they made the original payment. Additionally, the enhanced illness payment for those required to self-isolate or those people who have been diagnosed with coronavirus will be increased from €305 to €350 per week, bringing it in line with the new unemployment payment. So on foot of all these measures, no worker that loses their jobs should receive less than €350 per week. I think it's fair to say that unprecedented times call for unprecedented measures. And today's stimulus package will protect average earnings. I hope it's going to maintain demand, provide enhanced income supports for those people who are impacted by COVID-19, and ultimately position the economy to overcome the shock of this pandemic. I'd like to, as I hope I do every time I speak, just acknowledge genuinely the hard work of the people in our department who have done enormous work in the last week to try and get the some 118,000 people who came through our doors and made online applications into payment at the beginning of this week. So I just want to acknowledge that. I know we're going to have many more difficult days ahead, but I think we are confident that we can meet the challenges that everybody faces once we all stick together.
Can I just ask, in relation to the Leaving Cert, Minister Joe McHugh said that he intended that he wanted it to go forward. Was there any discussion about that at Cabinet? And just on the social welfare payments, just to clarify, on the normal job seekers allowance and payment, they're to remain the same at the 200 mark. Is that correct?
Just on the issue of the Leaving Cert, Minister McHugh joined us by phone at Cabinet today. We're having unusual Cabinet meetings. We're in separate rooms, and some people coming in by video conference, others by voice conference, and that's done for the obvious reasons around social distancing, that none of us spend more than 2 hours in the same room together, and if a group of us get sick, there'll still be a core 8 group that can be the government. So he joined us from phone, from Donegal, these actions apply until the 19th of April. So, obviously we're all hoping that schools might be able to come back in May and June and have the Leaving Cert in the normal way. But if that doesn't happen, he is working on contingency plans to allow the Leaving Cert to go ahead. The Junior Cert also, if possible, but obviously the Leaving Cert is more important. And also college exams as well. So we'll do everything possible or feasible that we can to allow the Leaving Cert go ahead, so that that group of young people can start college as normal in September or October, if that's possible. And I'd encourage them all to continue studying for those exams, because there's a very good chance that they are going to happen.
So, Christine, the base rate is still €203. The qualified adult rate, the qualified children's rate, supplementary welfare allowances, supplementary rent allowances are all part of the package of measures that are available to job seekers before last week. So they're all still the same.
It is probably a question for either Minister Donoghue or Minister Doherty, or both. People who've lost their jobs have pressing need for money. When can they expect the increased COVID payment to be paid? For employers who are considering whether or not they keep on staff, when exactly can they expect the increase, the wage subsidy for them to be paid? And then a question for the Taoiseach. Government formation talks have moved at a snail's pace so far. At this point, with an escalating crisis, shouldn't they be accelerated? Don't we need a stable, secure government at this time? And would you encourage the Green Party to get back involved in those talks?
So the payment will start this Friday, Cormac?
And the subsidy that will be made available to employers will commence on Thursday and Friday. So if the legislation passes through the Dáil on Thursday evening, the Revenue Commissioner is ready to go. And the analysis that we have responded back to is that as we see demand in more parts of our economy begin to decline, income is rapidly falling. The Taoiseach, in recognition of this, asked myself, Heather and Regina to put together a response back to all of this over the last number of days. And this is what we have done in this package. In an environment due to public health guidance in which demand is falling quicker and quicker, the income of more and more companies is falling as fast as that. And the vista that Regina painted of a huge unemployment challenge approaching our country is what this package of measures is designed to tackle. Because what we are looking to do through working across all government departments is put in place measures that for employers at the moment who are considering making somebody unemployed, to get them to access this subsidy, move into this scheme, and then when the economy recovers, through the work that Heather and Regina do through their departments, then have citizens who still have a relationship with their employer, hopefully are still working with them in some way, ready to go. And this scheme is really fast, it's really quick, and it is designed to anticipate a great challenge and to do our best to reduce the scale of it.
Cormac, just to answer your question, as I'm sure you can understand, the focus for government has been and has to be on dealing with the Covid-19 emergency and all of its aspects, health, economic and international. And all of us here spent today focused on that. In fairness, the opposition will be focused on it too, because the Dáil is meeting on Thursday, the Seanad on Friday. I'll be attending the European Council by video conference on Thursday, where we're going to be talking about coordinating the member states, but also the particular impact that this is going to have on the national debts of the 27 member states and everything that will flow from that. So our job has to be focused on COVID-19, on this health and economic emergency. But to the extent that we can find time, we are finding time for those negotiations. And certainly the Taoiseach, Minister Humphreys, Minister Donoghue will be involved in talks tomorrow with Fianna Fáil to see if we can agree a common paper on the way forward. And we are open to talking to the Greens, Labour, Social Democrats, other groups that may wish to speak to us. But the priority has to be COVID-19, and I think people would expect no less.
Just in relation to agency staff that work within the HSE, hi, I'm over here. I assume that they also can avail of the sick pay because they, when they work in the HSE, they don't normally have sick pay, so they can avail of it. But also, is there any conversation about childcare workers who have lost their jobs in the various creches that have closed down and how they may be re-employed to look after kids of parents who are on the front lines?
Agency workers are self-employed, so they are covered. They'll get the full $350 a week if they have to self-isolate. Some agency workers are also PAY as well as self-employed, but the short answer to your question is yes. There is a lot of work being done led by Minister Zapone around childcare, around what we can do to make sure that the childcare sector bounces back quickly when we're able to reopen it, and also to see if we can do something in the interim to provide childcare for key workers, people working in the health service, but also people working beyond that in lots of other key sectors as well. But the creches and nurseries and early childhood education centres were closed for public health reasons. So it's not just straightforward to reopen them, but work is being done led by Minister Zapone on that, and we'd hope to get somewhere in the next couple of days, if not next week.
Question for Mr. Donoghue. Will an emergency budget be required if you have to prolong this wage subsidy scheme beyond the initial period? Thank you.
The answer to that question, Arthur, will depend on the duration of the crisis that we are in. By the passage of the legislation and work that we have already done on our budgets for 2020, I believe we will be able to sustain the early part of our response back. But the longer this challenge goes on, the more likely it is that I will have to work within the Dáil to look at how we can strengthen our ability to do it. But that's actually an element in our thinking here, because what we are looking to do is look at how we can intervene very quickly and at scale at the start of this great economic difficulty. And by doing that, not only we hope offer support to our citizens, but also intervene in trying to prevent more and more jobs being lost. Because the core of a healthy economy are good jobs, and a lot of them, and they're being lost at the moment, and more could be lost in the future. And the more successful we are preventing that, the more likely it is that we can at least be close to a budgetary framework for 2020 that we outlined in 2019.
If I could follow up on that, you say that the package is around €3.7 billion to last around 12 weeks. How confident are you that you'll be able to access a similar amount of money if these measures needed to be extended?
Well, I am confident that our state will be able to access the funding that we need to deliver these measures. We came into 2020 with a growing surplus. It's fair to say that all of that has now been used in responding back to the public health needs that we had just over 2 weeks ago, and also due to the very sudden decline in tax revenue that's very likely to take place in March as a result of the huge change in economic activity within our country. I am confident that due to the approach the Taoiseach has taken in supporting me in all of the different budgets I've done, the work that we have done in moving from deficit to surplus, that we will be able to access funding and will be able to draw upon reserves that we both have as a country ourselves, and if we need to, borrow further to respond back to this great challenge. As you'll know, there is a meeting of European finance ministers taking place tonight. And the common theme that everybody now has, and I know the Taoiseach will be addressing this as well later on in the week when he talks with heads of government, is how countries can pay for their response back to a virus that knows no boundaries or knows no national borders. And we'll need to engage with each other regarding how we can do that.
Taoiseach, is there anything you can say to people who will be watching this at home who would be afraid about all the new measures that are coming in and that sort of thing? Is there anything you say to reassure them?
I think we're all a little bit afraid, and it's perfectly natural and normal to be a little bit afraid. You know, we can all see what's happening in Spain, what's happening in Italy, only 2 or 3 hours flight from here, and that frightens us all. But what I can say to people is that we have a slight advantage in Ireland in that we're a little bit further away from those countries, further away from the centre of the outbreak, and that has given us time to put in place a comprehensive strategy, one that will minimise the number of people who are infected and maximise the number of people who survive COVID-19. And we've had that advantage, if you like, that bit of time to put in place the strategy that we believe works best, and certainly has worked best in places like South Korea and Singapore, where they haven't had the number of deaths anyway approaching what we've seen, for example, in European countries, and that's the model that we're following. But we really need people to work with us. We're getting great support and great work from our health service, from our public servants, from the supply chain, from everyone. But we really need the whole of the general public to get behind our health service, our health workers, and look after and protect people who may become sick by following the advice that's being given. And it really is in our hands. I think somebody said on the radio that doctors can save hundreds of people in hospitals and ICUs, but actually the general public can save thousands of people, certainly hundreds of people, if we adhere and if we follow the advice that our public health experts are giving us.
Taoiseach, in announcing the restrictions here, you say that you'd always like to have policing by consent, not coercion. It's always the way we've done things. But if people do ignore the sanctions, the restrictions, and if they endanger public health, will there be any sanctions at all? Will there be any detentions, any fines proposed, anything like that?
I don't think we've provisioned for fines, but obviously there are powers that the Gardaí have since last week to detain people. And also there's other legislation, for example, under the Public Order Act, and there's legislation under the 1947 Health Act that actually is very far-reaching, that was brought in place for public health emergencies a long time ago relating to TB and diphtheria. So there are powers there, and if we have to legislate for more powers, well then we can. But I really think and I really believe that the best way that we can achieve the best outcome is for Irish people to be at their best. And to look out for each other, to understand the risks, to avoid getting the infection themselves, and to avoid affecting people who are vulnerable, older people and people with chronic diseases who really are at high risk from this virus. And I think we're a good people. And, you know, even though we did see some scenes that were not good at the weekend, by and large, people have been following the advice. As the CMO would say, most people most of the time are doing the right thing, and that's kind of what we need to continue. We just need to step it up a bit more. Thank you.
Thank you.
2112, 123, 456, 7, 8, 9, 10. Yeah.
Evening, ladies and gentlemen. Thank you as always for being here. This evening we are confirming that we have an additional 204 cases of COVID-19 diagnosed since yesterday, bringing the total to 1,329, reporting that there has been one additional death of a male in the East with an underlying condition, and extending mine and our condolences to the family and friends of the individual concerned. A breakdown of 965 cases available midnight the night before last shows that 55% of them are male with a median age of 45. 277 have been hospitalised. 36 of them were admitted to ICU. 247 or 26%, about 1 in 4, which has been the case all along, associated with healthcare workers. Dublin has the highest number of cases at 535, which represents 55% of the total. And in terms of transmission status, community transmission accounts for 47%. In terms of the global position, there have been 372,757 cases diagnosed with 16,231 deaths. And in Europe, in Italy, they have now reported 63,927 cases. In Spain, 33,089. In Germany, 29,212. In France, 19,856. And in the United Kingdom, 8,077. As you'll be aware, since we were with you last, we held a meeting of the National Public Health Emergency Team, which concluded this morning and made some decisions and provided some advice to government. And I'll just go through some of that briefly with you, if I may. So we recommended, firstly, that we adopt the WHO case definition as of the 23rd of March 2020, and to update our relevant guidance and algorithms and to publish these online, and that has happened. The HSE to put in place measures to increase our testing capacity in line with our updated case definition, and that is happening. For all suspect and confirmed cases, including those who are awaiting a test or test results, and the HSE to revert use in line with current policy. In terms of our NEFIT meeting today, that there were an observed day on day, and there had been 6 deaths. The fact that community cases and the cases were associated with to government said amount of compliance with the disease to strengthen the response. A number of different public health measures to government. Theatres, clubs, gyms, leisure centres, hairdressers, libraries and other similar outlets should close. That hotels would limit occupancy to essential, non-social and non-tourist reasons. That all non-essential retail outlets would close to members of the public, and all other retail outlets would implement physical distancing arrangements. That all cafes and restaurants would limit supply to takeaway food or delivery, and implement physical distancing measures in respect of queuing. That all sporting events to be cancelled, including those taking place behind closed doors. That all playgrounds and holiday or caravan parks would close. That all places of worship would restrict numbers entering at any one time to ensure adequate physical distancing. Significantly to raise the amount of money available on cashless card transactions. That all organised social indoor or outdoor events of any size would not take place. That social distancing, and as far as is practicable, would be ensured between clients and patients in confined settings such as long-term care facilities, either for the elderly or persons with special needs, psychiatric institutions, homeless shelters and prisons. That measures applicable to public transport, including cleaning schedules on public transport, to be improved. That people should not use public transport unless absolutely necessary, and that transport companies would apply social distancing measures and limit the numbers permitted on public transport at any one point in time, and that Gardaí would increase interventions where venues or outlets are not in compliance with, or where groups of people are not adhering to recommended social distancing measures. That all household contacts of a suspect case, that is a person who is awaiting a test or test result, would restrict movements until the test is reported negative, or for 14 days, whichever is the shorter. That individuals would work from home unless attendance in the workplace is absolutely essential. That social gatherings of individuals outdoors should be no more than 4 persons, unless all those individuals are from the same household, that all non-essential indoor visits to other persons' homes should be avoided, that all crowded places, including public amenities, should be avoided, and that all cruise ship travel would cease. We intend to keep these measures under review and recommend that they are in place until Sunday, the 19th of April 2020, and we'll identify as we go along the response to the disease arising from some of these measures, the implementation of these measures in our ongoing evaluation as to whether additional measures are necessary. So we're happy to take any questions that you have in relation to any or all of that.
Tony, I just might focus first in terms of testing. So 17,992 tests carried out as of midnight last night. What's the current daily testing capacity in terms of how many tests are being processed every day?
If you don't mind, Killian de Gascon has joined us this evening to give us a little bit more detail as well as answers to that particular question. I might hand over to Killian if that's okay.
Okay, thanks. So at the National Virus Reference Laboratory, we're in the region of 1,300 tests per day at the moment. And then in the laboratories around the country, we're in the region of about 750 tests per day. Over the coming days, we expect that capacity to ramp up significantly, and we will get to the region of probably about 3,000 tests per day by next week, and that will continue to increase over the coming sort of 4 weeks, probably to a capacity of 15,000 to 16,000 tests per day. So I think it's been well documented that there have been sort of challenges in the context of global supply chains around lysis buffer and reagents for testing. And in addition, there has been, I suppose, a significant demand for commercial kits. So the assays that we use to do the tests in the laboratories have also experienced supply chain shortages, because I guess that's always the problem when you're in the middle of a pandemic. Everybody is pulling on the same supply resource. But at this stage, as I said, we're seeing a significant increase in laboratory capacity, and that will continue over the next 3 to 4 weeks.
In terms of the average wait time, that was about a week, wasn't it? What is that at this point?
So I suppose there are kind of 3 questions in there. So I suppose maybe just to go through the process for people. So there's an initial consultation with the GP, which brings you into the system. So there's an electronic referral at that point. Then that refers you to a sampling centre. So there's up to 41 sampling centres in the community. So that's significantly increased capacity at that element. And then the sample itself comes to the laboratory for testing. So there's a number of steps through the process, and in the laboratory at this point where we're currently dealing with samples from the last sort of 24 to 48 hours. So at the laboratory side of things, we're working on samples that would have been taken at, say, on Sunday at this point. If we look at the last week, so the last time I would have been here, I talked about a turnaround time averaging about 10 to 12 hours, which would have been from the time the sample arrives at the laboratory to the time that the result is issued. And what we have seen over the last week, not surprisingly with the increase in demand, is that turnaround time has drifted out to about 26 hours from the time the sample arrives at the lab to the time the sample is issued. But again, it's just important to highlight that those will be samples from the community where people have been deemed to be well enough to self-isolate at home. And it is important to highlight that the message or the intervention, if you like, is about self-isolation. So the majority of hospital tests at this point are being performed at hospital. So for hospitalised patients are being performed on hospital sites. So their turnaround times would be significantly shorter than that.
Tony, can I just ask, just a lot of concern from healthcare professionals over the past 24 hours about protective gear and other issues. Have any of the patients, the 7 patients who have died so far, been healthcare workers?
We don't comment on the individual occupations or otherwise because of the low numbers as we do anything else. But with regards to personal protective equipment, huge challenges for us and huge challenges globally. We know in New York and other places they're running low on stock, and we face equal challenges in a very competitive global market where there are export restrictions and where there's a great deal of volatility. That said, as we've said, we have secured a supply chain which is due to, we hope to begin arriving from China this coming Sunday, which will bring considerable stock of personal protective equipment, including protective masks, gowns and goggles. Our current stocks are certainly low, and we're in discussions with our hospitals community to make sure to reinforce the message as to how they should be used appropriately by those people who most need them in the most at-risk settings, particularly intensive care units and elsewhere, and also to remind people on the importance of not using them inappropriately because that will deplete our stocks. But we still have batches coming through until we reach that, hopefully that the first of many protected planes coming from China this coming Sunday. We're hoping that will start.
One more from me then. You've outlined how many healthcare workers have contracted coronavirus in terms of this, at this point. Will you be telling us at any point how many of them were in intensive care units or requiring specialist care? Is that going to figure in?
The number of healthcare workers who are accounted for by hospitalisations, we have no plan to reveal that information at this point in time, Richard.
Killian, Shane Beattie from News Talk. It appears on social media we're at a stage now where people 10 days ago, 12 days ago, 9 days ago were displaying symptoms, looked for a test and still have not got the test and now no longer have symptoms. I'm just wondering, is there a point in those people still getting tested? And do they, if you have symptoms and then your symptoms go away, when you're tested, will COVID-19 show up in those tests?
It's a really good question. It really will depend on the individual. So what we know from the Chinese data set from about 72,000 individuals is that for between 7 and 12 days typically after the onset of illness. We do know that if people have a more severe illness, that the virus is detectable for a longer period of time. So it will really depend on the individual as to whether the virus remains detectable at the point that they have their sample tested.
And what do people do if they've been self-isolating because they think they have COVID-19, waiting for a test, then don't get the test and get better, and then get a test and COVID-19 shows up? What do they do? People, because there's a lot of people out there now saying that, particularly around the weekend before St. Patrick's Day, they may have had symptoms which now have gone away, but they're still waiting for a test.
Yeah.
Well, the advice is to stay isolated for 14 days and to be 5 days symptom-free, and that test remains, and that's the most important advice we would give anybody in those circumstances, whether or not to have a test. And it's important to emphasise that the purpose of the test is to detect COVID, not necessarily for somebody's health reasons, because it makes no difference to the course of their illness. It's to improve our detection rate so we can instigate contact tracing. So the fact that they haven't got a test makes no difference to the course of their illness.
Would you accept that it's causing anxiety for some people that they're not getting a test, and that this becomes something that they're obsessed with, is getting a test to know do they have it or not?
I appreciate that, but I would reassure anybody who's listening tonight that just stick to that advice. Stay isolated for 14 days until you're 5 days symptom-free. The test will make no difference to the course of your illness. If you're feeling unwell, that's a separate matter. That means you have to seek help either through your general practitioner or otherwise. So don't let the absence of a test or the delay in getting a test lead to you seeking delay in seeking help, medical help, if that's what's needed. But for the vast majority of people, as you pointed out in your question, many of these flu-like illnesses, including COVID-19, are self-limiting and will disappear in a short period of time.
Just a final question, very briefly, Killian. In Italy, the head of the agency collating the figures says that the number of cases could be 10 times. The reality is the number of cases could be 10 times what the actual number is in Italy. So 64,000 earlier today, that could be 640,000. Is there a possibility that the number we're seeing today, that it's 10 times worse out there right now?
I suppose I can't sit here and say there's not a possibility, because that would be impossible to prove. But I think if you look at the positivity rate of the number of samples that we're testing, so we're in or around 6%. So that would suggest that a lot of the testing that we're doing is of, they could well be viral illnesses that are not linked to SARS-CoV-2 or COVID-19. So it's obviously possible that there's a greater burden of disease out there, but certainly the testing data that we have to date wouldn't really support that contention. But obviously that may change in the coming weeks.
Okay, thank you.
Hi, Paul. Is a changed case definition, patient with fever and another sign such as a cough? I think up to now it was fever or cough,
yes.
New fever or cough.
Yes. Yes.
Why so? And obviously this is going to make a change to the number of people who are referred for testing.
Yeah, so just to deal with that, so we spent quite a bit of time at our NEFID meeting having a discussion about this. What's clear is that the volume of people, the number of people, and I gave you an indication of that yesterday evening, who are seeking testing has been very large. A very significant increase in number of people coming forward since we changed the case definition to remove the country-specific component 10 days ago. over the last 10 days, something in the order of about 20,000 or so people a day have sought testing. If we were to test at that regime, we would, by a considerable distance, become the number one country in the world for testing. And what that says to us, that a lot of the health-seeking behaviour coming forward and resulting in requests for testing are people who are not appropriate for testing. And we needed to think about focusing our case definition to identify people with a higher probability of having this particular infection. And so that's the particular reason for doing that, to bring a focus onto the testing and to ensure that we focus the testing more around cases that are more likely to be SARS-CoV-2. Bear in mind the point that Killian shared with you a moment ago, that even still with the significant increase in testing that we've had, which still brings us into line with the majority of countries in the world, are in fact one of the highest in Europe at the moment in terms of testing, of the numbers of tests that have been conducted, still only 6% of those are confirmed cases. So 94% of them are negative. And that has been a challenge to continue to reach all of the people who would seek a test and to get those tests to people in the timeframes that they would like. The important measure, as Dr. Henry has said, that we must emphasise, if people are waiting for a test, to assume that they have the disease, to self-isolate, and that their contacts restrict their movements. That's the essential public health action that would prevent transmission of this virus. That's underscored by the importance of other information that's become available to us that shows that the number of contacts being identified by the contact tracing teams per case has significantly, and now it's in around 5. So in effect, the cases are giving rise to contacts among, by and large, their household contacts. And if we can ensure that people who have symptoms, as well as their household contacts, self-isolate, we can limit the transmission of this disease. That's the important measure. The test doesn't tell us anything further to give us good advice to those individuals. What we then want to do is to ensure that the testing is focused on the priority groups for testing. We will follow the ECDC advice in relation to that, in relation to hospitalisation, healthcare workers and so on. And as we go forward in the next number of weeks, we will grow the capacity to get us up to something in the region of 15,000 tests per day, which is not where we are at the moment, but that's where we want to go, because we want to continue to implement the policy the WHO has recommended using this case definition to test as many people as we can and to contact trace in respect of as many people as we can. We think that's the measure that's really critical in terms of controlling this particular disease. The measures that we've mandated are very important, but on their own they will not be enough if we don't contact trace and case identify to the maximum extent that we can. And while we have a challenge in testing every person who would seek to be tested at this moment in time, we think the right response for us now as a country is to try to focus that testing on those who are most likely to have the disease. That's the reason for the change in the case definition.
Introduced
Many more people than we need, or that are net tested at that rate, 20,000 or so a day over the last 10 days. If we had done that level of testing, it would put us in a situation world. We don't think it's necessary for the public health management WHO case definition.
Just one of your colleagues, Paul, asked a question about people who might be concerned. Understand this, that the test is of little or no value in people about what happens if you're negative and you become, and people who are asymptomatic and therefore and trying to access no use to you if you have no symptoms.
Yeah. Cast our net to
say we'll right for us to remove the country requirement because of the symptoms, like fever, like symptoms. There was a very significant increase in what we've seen coming forward for tests of it, this, and the right thing forward for a particular infection. And we think that's the chance that we have of controlling the spread of this. They're listening to me saying this, that the key and their house, that's the measure.
The question I asked last night for killing processes have expired.
So no, is the short answer, would have a shelf life in the range of 3 to 6 months typically, detecting virus when, from the time, probably more in many cases. So there's been or anything like that. This question, there's a couple of processes. There's the sampling problem. I think it's fair to say that 3 to 4 weeks is to ensure that they're being tested in the laboratory. So where the definitive answer on that, we know from the laboratory perspective, the 22nd and 23rd. So that's what we're seeing at the national. The turnaround time has increased to about 26 hours from the time. I think the other thing, maybe just to add on the in contrast to say measles or chickenpox, there is no constellation of symptoms that is.
Good evening, Michelle Hennessy from the Journal.ie. If we just come back to the the testing numbers that you gave us tonight, the almost 18,000 it was so far, or is this the number of people who have had swabs taken?
Yeah, really good question, says the number that has been resulted.
Okay.
Yeah.
Higher than that?
So, but yeah, based on our experience, as I said, we have sampled on the 23rd, so there would be a number of patients who have had yet been tested and have not received results.
Okay. But the delay and people being symptomatic, obviously under illness, but presumably it is a factor in contact tracing if the person could have passed it on to other people. So how does that impact on that process?
Well,
Well, so the process is still the same. Contacts are identified, and the clear advice that they're given is in relation to any symptom stage to report those symptoms, and they would be tested in those circumstances. And the contacts, particularly household contacts, close household contacts of a person who suspects that they may have this illness and who is awaiting a test, or where a test has been done and they're awaiting a result, is to assume that this is the disease and to self-isolate while they wait. And if we put that measure in place, we know now, because of the number of contacts per case we're seeing, in and around 5 per case that's identified, which is very encouraging in terms of the social distancing measures that have been in place now for 10 days and that we're strengthening. We think that that will be a really important way. We think that will feed through into interrupting the transmission of this virus. That's the key measure. So the test doesn't offer us any additional, if you have those symptoms, self-isolate for 14 days, and the contacts in your household, the people you live with, to also restrict their movements as though they were contacts of a confirmed case. That's the critical public health measure. That's the message we really want you to help us to try to get out. I should have said in respect of the CGP and the IMO today, we know we need to help the GPs with good quality, clear guidance and what we call algorithms, which are testing procedures to try to focus, if you like, the diagnosis on the WHO case definition of those individuals that we talk about. If we're successful in that the percentage that Killian gave you of 6% positive.
Did you want to come in on that as well, Colin?
No, just to go back to that advice, it really is important. The test doesn't disclose symptoms. And if you act as if you have it, you'll do the right thing in isolating yourself and your immediate family members. That's the core message.
I mean, I should point out that it is still our clear intention to test people in those circumstances. We have a challenge in doing it for all of the numbers that we have, but as we've said, we're trying to build our capacity so that we can do that in all circumstances. That's our policy in Europe. We're not following that advice in the way that we are.
Just on healthcare workers, I know that you didn't want to comment on individual cases when it comes to the deaths, but I'm not sure if you're aware that there's a high-profile individual who online has been spreading information that one of the deaths in Ireland was a healthcare worker. So I just want to give you the opportunity, if that is the case, or if it's not the case, I mean, to clear that up.
I don't know who that person is. I'm working on the assumption in your question that that's somebody not a part of privacy and confidentiality, and something that I think we could not criticise strongly enough.
But can I add
privacy and the confidentiality of individuals, particularly at the time of bereavement, is paramount, and that's the kind of information that should not be spread by anybody on social media.
I'd just like to add to that, and I know I've talked to some of you individually in this, the great majority of such rumours, that whether it was rumours of deaths among students in Cork or otherwise, are totally unfounded and have no basis, in fact, and serve only to create anxiety where there already is a great amount of anxiety among people out there in society. So commenting on this story one way or another would undo what I just said, but you can read what you want into what I'm saying now.
Last question for me then, also on healthcare workers. Obviously there's a high number in the numbers of healthcare workers who have it. Do you have any kind of a breakdown of whether they had close contact? Presumably a lot of them did, with confirmed cases, because there have been a lot of healthcare workers who are called, all of them, to be used by all healthcare workers rather than people who are directly working with confirmed cases.
We have very NMO and other organisations, and I had a very useful collaboration with Gabriel Collar and Martin Varley at the IHCA this week. As I said earlier, to answer the question of one of your colleagues earlier, we secured a really good order which is coming from China beginning next Sunday, hopefully. In the meantime, have to be protected in the right circumstances when they're doing the right procedure. And we've issued very, but in terms of their own distancing between people, important here, and it's important, and our staff need to feel supported. But they're of distancing, of hygiene, as close as. So to anybody who's worried, yes, we face challenges in we are maintaining stocks in all centres where it's needed. Large steady supply which you've secured from China.
Thank you.
Just one fairly quick question. Last week you spoke about modelling that you'd been doing as regards where you figured the numbers of cases might go. You'd suggested on Sunday that could be as high as 355. It was following a fairly significant ramping up. We haven't reached that. You mentioned that, I'll phrase this wrong, sorry, because my brain's a bit melted, but I think you said it's now down from 20 people in close contacts or making 20 contacts, that's gone down to 5. So there are two reasonably positive bits of news, I would have thought. Now, given how significantly testing is going to ramp up, is there any succour to be taken from that, or is it just too early to say?
Look, it's better to see signs that like that than not. I think the encouraging one for me is the one that I mentioned around the 20 contacts dropping to 5. We want to see that that's maintained and maybe even reduced further if we can. We think that will reduce the reproductive number of the virus, the likelihood of transmission, and that's our objective in terms of protecting the population. In terms of the other, I think it's a little early to say. Obviously, it's better to see fewer cases than not. The projections, I think, when we shared them at the earlier part of the week, were very early. It's a very young model, so predicting reliably forward more than a number of days is difficult. But each day, as we add the new numbers of cases and other detail that we're getting now in relation to the cases, that model will get more stable. Its predictability and so on will be more robust, and we'll be in a position to make more projections as we go forward. So I think it'd be wrong for me to start to suggest that we think we're, because that number is lower than we might have projected, that we think at this early stage those measures are working. What we'll be doing over the course of the next week is ensuring that we monitor what happens, because the incubation period, as we know, of 14 days, we're at about a point now where we're about that point past the initial set of social distancing measures that we introduced. And we think if we're going to see an effect, it might be around in the course of the next week to 2 weeks. And we'll continue to observe that and to report on that. But I don't want to, let's say, overclaim in terms of what we're seeing at this early stage in the epidemic. The numbers are small, and it's too early for us to draw any kind of definitive conclusions. Thank you.
Let's ask a few figure-related questions. Last week, a figure of between 10 and 15,000 tests per day was put forward. At what point might we reach that? I mean, Killian, you said something like we might get to a point where we're doing 3,000 per day or processing 3,000 samples per day in our labs. I mean, what point will we get to tens of thousands or above 10,000 sort of figure?
So the plan at the moment is that will be in around 4 weeks' time, barring incident.
How many sampling centres are up and running at this point?
41 from
41.
None 2 weeks ago. Yeah.
And how many labs?
In addition to Killian's lab, we have, I think, 12 acute hospital sites and more labs coming on board. And
one of the public health laboratories as well.
Yeah.
Yeah.
Just a final one for me. Just in terms of the mortality rate in this country, it seems to be lower than many other Western countries. Is there any hypothesis for that at this point, or is it too early?
It's just too early to say.
I think it's too early. The median age of our cases is different to other countries as well, in the mid-40s. But the number of cases is small for us to calculate any reliable rates off a single. We're still in single figures. We'll keep watching that and reporting that and comparing it.
Can I ask you, in relation to the near 8,000 people who have been tested, how many of those, or a percentage of those, how many have received their results?
So the numbers that were given today, they have all received the results. The 17,000 is mine.
And in terms of the backlog or number of people who are waiting to be tested, what numbers are we talking about there?
So I personally don't have that number to hand. As I said, we're in the NBRL, we're probably a day to 2 days behind. So we're dealing with samples that were a day to 2 days old.
There had been about a figure of about 40,000 or so.
Sorry, so they're not.
2 days ago.
I guess, yeah, that's the terminology issue again, where people have been referred for sampling to have a specimen taken, but have not yet had that specimen taken. And then there's another cohort that maybe have been sampled, but have not yet received a result. So I don't have that breakdown.
There's no question, as we've said, Fergal, that the number of people seeking testing each day has exceeded our capacity to test. But we think many of the people seeking tests are people who don't need to seek tests and who don't fit the tighter case definition that we've now approved.
They're worried well.
Well, I wouldn't necessarily put it in that way. They may well be people who have other forms of viral illness that are much less likely to be SARS-CoV, that don't have some of the features that we think are important in this in terms of fever and cough. They might have simple things like runny noses and things of that nature. So
that'd be a role for GPs, though, wouldn't it? That GPs would take a particular focus on the algorithms and follow them through.
And they do, and so they did follow the algorithms. And obviously, there's been an understandable level of both anxiety and a desire on the part of people to get tested, and probably a desire on the part of many people to get a test almost as assurance that they don't have the disease when they're not well, when they're not unwell. Sorry, when they're unwell. I'm confusing myself.
Or an abundance of caution.
So people being very cautious, which is an understandable thing. People are concerned. People are worried. We monitor that through our market research information that we collect twice a week, and we see that people are more worried now than they were previously. It's understandable that people, when they have very mild symptoms, will come forward maybe at an earlier stage than they would, are more likely to present with very mild symptoms, or perhaps to seek the assurance of a test in a situation where they don't have any symptoms at all. And all of that has greatly exceeded our capacity to test and is not giving us any better information or ability to manage this disease. And so that's why we've tried to focus the test on a tighter case definition, if I can use that term, to work with the GPs, and we've communicated that out through the HPSC in the usual way to refine the algorithm that we're using and to continue to try to detect as many cases as we can and to contact those cases in line with the WHO advice. Thanks, Farrell.
Donald Trump said that you have to make sure that the cure isn't worse than the problem. Is anybody in your group or in wider government doing any modelling about this? Obviously, this is going to have a huge economic cost and so on.
So as part of the work we're doing on modelling, there are two components, and I think at a point maybe not too far into the future, we'll arrange for some of the team involved in the modelling work to come and present as part of our briefing here. But as part of this, there's a mathematical modelling which is about prediction and projecting forward numbers. There's also some modelling on the downstream impacts from an economic and social point of view as part of that work as well. So that's very much part of our consideration. We do want to understand not just qualitatively what we think the impacts of this might be, and we talk a lot in this forum about the impacts in the health service. We do want to try to understand what the impacts are on society in general, and some of that modelling work is focused on that. And I'd also point to the fact that we're beginning to do some work to try to stimulate research interest in SARS-CoV and in COVID-19, and all of the questions that arise in relation, which are not just laboratory and technical questions. We've spoken a little about the potential mental health impacts of some of the measures that are in place in society and other unintended consequences of long periods of time with the kinds of measures like this in place that we have. What impact might it have on things like substance misuse and consumption of alcohol, for example? What impact might it have on things like domestic violence and things of that nature? All of those things need to be part of our consideration and part of our alertness, if you like, to the unintended consequences of some of the measures that are in place, and to try to work to model that, to measure it, and to research it in a way to understand it better.
And finally, when you think about Italy, you remember 11 towns were locked down originally, and then you hear a lot about Bergamo and so on. I'm not getting a sense of any sort of regional play here. Will that come at a time where eventually you'll say, Monaghan or somewhere like that, the disease is circulating there and you should be wary or something? Or will we get that sort of feel? Or basically we're just being considered as one entity, the Republic and maybe the island. But will that kind of regionality be evident as things move on?
And I think as we move on, our trending will become, let's say, as the number of cases grow, our ability to be able to interpret those regional variations will increase. If we see significant changes at a local level that merit more regionally based restrictions or measures or responses than we have in place at the country level overall, then we won't hesitate to respond to those. But at the moment, we haven't observed anything of that nature. Clearly, there are clusters in place in particular locations, and the response to those individual clusters has been part of our let's say national and local and regional response. But in terms of, let's say, societal level or community level responses of the kind that you've seen in Italy, we haven't identified the need for anything like that at this point in time here.
Sorry, Tony. Excuse me. For those of us at the back of the class, would you explain as clearly as would you explain as clearly as possible, language-wise, what changing the case definition today means? Because people might be wondering, what's the change about the symptoms? So, what's the difference today or tomorrow as opposed to yesterday with this?
So a case definition is very important in the diagnosis of any infectious disease. You look at the various different symptoms that a person has, and I think we made clear in the early stages of this, we also looked at the history that people had in terms of where they had come from in the world when travel was an important part of this. And at a point in time, we dropped that travel requirement. And part of the challenge of this disease is that the symptom component of the disease relates essentially to pretty common symptoms that, as Killian said earlier on, they're vague, they're not very specific to this particular illness, they're common to lots of types of respiratory common cold type infections, whereas the travel part might not have been that common. So we moved from a situation where maybe not very many people met the case definition because they hadn't been, for example, to Asia, they hadn't been to Italy, to a situation when we removed that component, the travel component, we were essentially identifying people with what are common symptoms. And the experience we've seen over the last 10 days or so since we did that, combined with the extent of concern there is in the population, led to a very significant increase in the number of people coming forward looking for testing, far more than I think is either necessary as a result of the management of this disease or feasible or sustainable from our point of view in terms of testing. And it was right and proper that we look at that and seek to focus the testing more on a smaller number of symptoms that in particular include fever and some other symptoms like cough and respiratory symptoms, and we've set that out. And that will be a more focused case definition that GPs will work with to identify patients, and so perhaps then not every person with cold-like symptoms will in fact be recommended for testing because they don't have a fever.
Okay.
And so that's to focus things more on this particular disease.
I know you don't like individual cases and all of that, but Claire Byrne said last night that she has COVID-19. She didn't have a fever. So are we going to have people now who have COVID-19 who, because they don't have a fever and respiratory issue, who have COVID-19 but they're not going to be tested because they don't have both?
So it is possible, but the vast majority, one of the most common symptoms is fever. It's a very important part of this particular illness. That's why it's part of the WHO case definition. That's why we're using the WHO case definition. The advice for people with symptoms of these kinds of illnesses, whether they have fever or not, still remains the same. That if an individual has mild symptoms, they should self-isolate. They should take the measures we're recommending in terms of their family contacts and controls. So the measures will be exactly the same that we're recommending for them and what they should do. And we think that's the important step in terms of the interruption of transmission of this particular disease. Thanks, Shane.
Quick, I promise. Just two things. When the test is taken, how long until the sample expires? And the other thing is, I'm just wondering about the 6% you said, because the numbers today is 7.3% on confirmed cases with the 17,992 or 3, whatever it was. It's actually 7.3, I think. So it's just one was the 6% from a few days before, just I don't want to report it wrong, you know.
Okay. Killian?
So, excuse me, just on the first part, the swabs themselves that we use would have a shelf life in the range of a number of months, so that's not a concern. From the point of view of after the sample has been taken, then in the swabs that we're currently using, there's a viral transport medium in there that sustains the virus in essence. So typically that gives us in the region of 7 to 10 days from the time the sample is taken to retrieve the virus. On the positivity rate, I think, so I'm just looking at the numbers that, I suppose what we've seen in the NVRL over the last week, I suppose, has been a range of positivity rates anywhere between sort of 5 and 9%. The number over that, I suppose, we're trying to be consistent and looking at a particular time frame. So at the last week where we had a positivity rate of 6.4% was what we had at the NVRL over sort of the week, say, ending Sunday. So it's possible that between the additional days, sorry, I don't know if Rona wants to come in there.
So
So we always, on a Tuesday, we report all of the tests completed as of Monday evening. So if you, so it's the number of positive results on a Monday as a component or as a fraction of the total tests done on a Monday. So if you
Yeah, so it
include
would've been a
the
price
additional
figure.
cases done in the last
Tiny
24
little.
hours, it will go up
I figured
small.
as much,
So.
but yeah. That's right. Thanks.
Okay, thank you very much.